Protocol Review, Circumferential Reduction, Circumference Mode Protocol. This treatment protocol involves using the V-contour applicator with a medium cover. After selecting the area and positioning the patient, divide the area into sub-areas based upon the total size of the area you have selected and based upon the shape and anatomy of that specific patient. If you find you have a patient with a larger BMI or one where the opposite side of the abdomen is difficult to reach, divide the abdomen in two parts. If you have a smaller patient with a more normal BMI and can easily see and reach both sides of the abdomen, you can cover the entire anterior abdomen in one large area. Select the appropriate cover, which is usually the medium cover unless you are reducing in very small areas or in proximity to bone. Set parameters on the device screen or handpiece. Note that when setting parameters, off is a black circle, 1 is as shown, 2 is as shown, and 3 is a full red circle. For circumferential reduction, begin with IR off, RF 3, and vacuum 1. Adjust parameters as the treatment progresses as needed for patient tolerance and comfort. But keep in mind, the goal is to reach temperature endpoint and maintain heat over time. To achieve this, it is important to communicate with the patient. Start by telling the patient the goal is a deep heating sensation that is not uncomfortable. Tell them you will be using a scale of 1 to 5. The scale is as follows: 1, very minimal warmth; 2, more warmth; 3, deep but comfortable warmth; 4, uncomfortable; and 5, very uncomfortable. The goal is to move the applicator to the next position before the patient gets to 4 or 5. Therefore, take a minute to explain the scale to the patient and ask the patient to let you know when you reach 3. They can either put up a finger or simply say, "now," or "hot." Once you have reviewed this with the patient and set the parameters, add a thin but visible layer of spray onto the treatment area. This treatment protocol for circumferential reduction requires applying stacked pulses. The first cycle is performed in a horizontal, snake-like fashion. The first pass is completed by applying 5 stacked pulses at each placement or segment. During the second pass, apply 4 stacked pulses. During the third pass, apply 3 stacked pulses. And during the fourth pass, apply 2 stacked pulses. Continue additional passes with 2 stacked pulses per segment until the endpoint temperature of 43 to 45 degrees is reached. Use the thermometer to measure endpoint temperature. If the temperature is reached before the cycle has completed, apply a single pulse only and continue treating over the area until a total of 5 minutes have elapsed for that cycle. Cycle 2. Maintenance. Next, turn the direction of the applicator so that you are moving across the area in a vertical snaking pattern. Reapply spray and begin pulsing with 2 stacked pulses in each segment for the first pass. You may continue with 2 stacked pulses if tolerated, or decrease to a single pulse as you repeat passes in the area. During this cycle, endpoint temperature should be reached again and maintained for a total of 5 minutes. At the end of cycle 2, you should have been treating for 10 minutes in total. Finally, for cycle 3, again, rotate the applicator and change direction so that you are moving in a horizontal snake pattern. Reapply spray and return to 2 stacked pulses in each segment for the first pass, and for any additional passes as tolerated. When necessary, adjust down to a single pulse in each segment. Remember, the goal is to reach the endpoint temperature of 43 to 45 degrees Celsius in the area and maintain the heat over a period of time. In order to do this comfortably, be sure to 1. Communicate with the patient so that you can move the applicator quickly when approaching maximal tolerance. 2. Adjust stacked pulses if needed to keep the patient comfortable. 3. Reapply a thin layer of spray to keep the patient comfortable and assist in movement. 4. Move to a single pulse technique in place of stacking when necessary to maintain heat. 5. Adjust the radio frequency if necessary for patient tolerance. Finally, remember that good contact of the cover with the skin at all times is essential. Make sure you maintain full contact. When applying the single treatment reduction protocol, repeat the same procedure in each area so that each area has been treated twice.